The technology adoption, of course, is the biggest challenge, but the challenge that is even more important is the knowledge of the management and the leadership in the field of technology, their willingness to introduce new means of providing care. And the other challenge is the adoption by the patients themselves. So adoption of technology, acceptance of management, and adaptive behavior of the patients would be the three elements to tackle. The adaptive element, where the people need to not want to be disrupted. Their life and their routine has got to not be disrupted when they're being cared for. Could you introduce a technology that will help them from the comfort of their own home? Can you convince them to adapt to it? Are they technology savvy already? That's the patient I'm asking about. And so the answer to all of that, of course, is they are ready, they're savvy, they're capable of handling a tablet or a device and deal with it. On the management side, do they understand the business case the way they should? Are they able to change the way they offer their service today? Can I take the hospital and extend it to the home, for example? One of those innovations is extending a secure environment like the hospital and extend it to the home and confirm that it is secure. And is the business case understood? Can they save money? Can they collaborate with the insurance company to save money? Will the government save money? Is the business case compelling enough? The answer to all that is it is. They just need to spend some time to make it happen. So adopting technology as the biggest challenge needs the other two challenges: the patient to accept and the provider to venture into it. To me, understanding how technology can replace clutter and replace paper and how electronic medical records is a must. Why are some countries venturing into it and others aren't? Personal health records. You know that you can collect more data and more records on patients using technology than you can through actual face-to-face visits. So technology is the way to go. A deployment of this must not be in the form of this country or this city has 1,000 people trialing it. We're talking about why do we not have 600,000 patients with kits in their homes being monitored and data being collected? That's good use of technology. Things we've done 10 years ago, why aren't they doing it now on a major or on a large scale? There's a lot of hesitance out there, and it's lack of information, lack of knowledge, and lack of not enough people taking a little bit of risk. And the risk is minute. With a small pilot, collect clinical data, 30 days later or 90 days later, you have your proof, then deploy right across the board. So that's our position on that. The key message will be that executives at hospitals, executives at health insurance companies, and governments, ministries of health, health authorities should really step back and look at what has been accomplished in the remote patient monitoring field and look at what people like us are presenting on technology that's been used in the market with lots of clinical data available, lots of surveys done on showing the value of such services, and ask themselves, and this is the message, we want them to ask themselves, why aren't they in it already? Why are we still talking about, would you do a pilot for 25 people? Would you introduce it here? The business case is clear. The pilots that have been made are very clear with great results. 10 years ago may have been in question. Today it's no longer in question. Why is it that I would want to wait till 2020 to deploy what others have deployed in 2010 or 2012 and they've seen amazing results? It behooves the executives to make a decision and proceed. If they're still not convinced, then we invite them tomorrow to start their pilots, do their own 3 to 6 months pilots, get their own clinical data, get their own surveys of their patients to see their take, and they're adapting to that kind of an extended healthcare, extended to the edge care, start collecting data and make a decision. So the key message tomorrow is, are you ready? Ready to deploy or ready to pilot? Either or. If you're not engaged in remote patient monitoring already, you're behind. Get moving. We feel that the breadth of speakers that you brought on board, the exclusivity you pretty much gave to select suppliers in the field that are successful, the well-managed conference that we're seeing. Even in the first 4 hours, we as a business have already seen amazing value in terms of whom we met, whom we received advice from. It's free consulting, talking to these people and talking to the delegates. They're educating us as we're sharing information. We're listening to people speak and we're getting a lot of notes. We're learning in 2 days what would have taken us in marketing and research probably 3 to 6 months worth of work to try and get such data. So the conference is definitely a worthy investment for us. We're thankful that we're participating, and we congratulate the organizers on putting on such an amazing group of delegates and exhibitors and speakers. It's very valuable.